Welcome to Mayo Clinic's ECG segment, Making Waves, continuing medical education podcast. Join us for a lively discussion on the latest and greatest in the field of electrocardiography. We'll discuss some of the exciting and innovative work happening at Mayo Clinic and beyond with the most brilliant minds in the space and provide valuable insights that can be directly applied to your practice. Welcome to Mayo Clinic's ECG segment, Making Waves. In this episode, we turn our attention to the intersection of oncology and electrophysiology, exploring how cancer and its therapies can influence heart rhythm. Joining us is a cardiac electrophysiologist with expertise in managing arrhythmias in complex medical settings, including cancer care. Our conversation will shed light on the relationship between cancer and arrhythmias, the types of rhythm disturbances that can emerge, and how treatment decisions must account for the interplay between cardiac and oncologic therapies. But first, let me introduce our guest today. Dr. Nicholas Tan is a cardiac electrophysiologist at Mayo Clinic in Rochester, Minnesota. Dr. Tan's journey began with a biomedical engineering degree from Johns Hopkins University. He then earned his medical degree and master's in biomedical investigation from the Cleveland Clinic Lerner College of Medicine. His training continued with residencies in internal medicine, his cardiology fellowship, and cardiac electrophysiology fellowship at Mayo Clinic in Rochester. More recently, Dr. Tan completed a master's degree in medical device innovation from the University of Minnesota. He is now pushing the boundaries of heart rhythm treatment with his research on device-based therapies, including pacing, defibrillation, and cardiac ablations, and even in the cancer space. Dr. Tan, thanks so much for joining us again.
No, thank you for having me. Really appreciate it.
Well, as I've been saying, the cancer space is one that we don't really think too much about, and one that is currently a growing area, and one that you've spent a lot of time thinking about. And when we think about these patients with arrhythmias and cancer patients, what makes this connection so important?
So, as you may be aware, cancer treatment has advanced leaps and bounds over the past few decades, and as a result, patients are living longer, even after they have been diagnosed with advanced malignancies in some circumstances. And as they live longer, cancer survivorship becomes really important too. And that's where the intersection between hematology and oncology comes with cardiology, because these patients live longer. They also um, um, sometimes suffer the consequences of whatever therapies they receive, and also live long enough to develop the traditional cardiovascular diseases that we typically see in older patients. So it's become an exciting area, an exciting intersection where you look at cardiac comorbidities in patients who traditionally don't live that long after being diagnosed with cancer. And this is how this whole field of cardio-oncology is born. Now, a subset of that um, is where electrophysiology comes in, where patients develop arrhythmias that can be associated with cancer, or just simply as a result of having lived longer. But this is a burgeoning field, if you will, where we are beginning to understand a little bit more about the implications of cancer survivorship and specifically about rhythm issues that are implicated.
So not only the intersection between cancer care and arrhythmias coming about, but this aging population that is not only, the longer we live, the more at risk we are to see cancer, but also the same thing on the rhythm side. Now, in terms of arrhythmias, what are more of the common ones you see? Are they the ones that we commonly see in other populations? How do you, what are the common ones that you're seeing present with?
So probably the most common one that we encounter in our practice is atrial fibrillation. And again, that's something that we commonly see in the general population as well. Now, a few special considerations to keep in mind is that not only are these patients living longer, but some of the cancer therapies um, that we use for treatment can be associated with atrial fibrillation as well. Um, uh, Ibrutinib is one, for example, that's often used for treating hematologic malignancies, but radiation therapy and some of the chemotherapies that directly affect the heart can all contribute this milieu where atrial fibrillation can develop. Now, you have atrial arrhythmias that can happen, but ventricular arrhythmias can be seen as well, especially when they start developing cardiomyopathies related to the cancer care. Heart block, conduction system abnormalities is not infrequently seen, especially if they have received mediastinal radiation, because again, when radiation therapy is delivered to the tumors, especially tumors that are centered within the chest, the heart suffers collateral damage as well, and the conduction system can be conduction system damage can be one of the side effects from that.
It's really interesting. So it's, the common arrhythmias that we see with the aging population of atrial fibrillation and also in this group, I think you bring up an important aspect of the treatment of these. Sometimes we think of trastuzumab with the reduction in systolic function of the heart, but ibrutinib you mentioned, and even radiation therapy that can affect the heart. And this kind of brings us to the point that, while you're managing the rhythm side of things, you also have the oncologists and hematologists that are helping to manage, the cancer treatment. And it's kind of this interplay. How do you manage arrhythmias in these patients where, you have different specialties, maybe drugs you're not familiar with or learning more about, new to the market? How do you work around that?
I think the most important element here is collaboration and communication. So you need to talk to multiple players here. Obviously, you need to engage with the patient, get some information from them on how they are doing and what the overall goals of care and prognosis is. Speaking with the oncologist is important as well, because you're not going to know all the drugs that are that they have at the array. And that's where the expertise is. But you need to work with them to figure out what may be some of the cardiovascular implications of some of the therapies that you're using, speaking to the pharmacist, and even sometimes engaging palliative care can be very important as well. And again, that's where keeping the big picture in mind is really key. You want to do what is best for the patient as a whole, rather than just hone in on specific elements of their care. And this is particularly important for patients who are so medically complex, where there are many elements that you have to consider.
It's really important. And I think that just comes down to, the premise of I know how you carry your patient care, but it really becomes a team effort. And it's the teamwork that really provides the best care to the patient. In today's episode, we explore the intersection between cancer and cardiac electrophysiology. Dr. Tan shared his insights into why arrhythmias are particularly relevant in this cancer patient population, the types of rhythm disturbances, the atrial ventricular arrhythmias that he brought up, and then how we have to be thoughtful for navigating treatment in these patients. Dr. Tan, thank you so much for sharing your expertise on this important topic in an area that you're really carving out to, be at least my go-to expert, and I know many others. Your perspective is really helpful, and I hope that bridging that gap between these two specialties is something we have to do, and we look forward to having you back again.
Thank you very much. Happy to be here.
Thank you for joining us today. We invite you to share your thoughts and suggestions about the podcast at cveducation.mayo.edu. Be sure to subscribe to a Mayo Clinic Cardiovascular CME podcast on your favorite platform, and tune in every other week to explore today's most pressing electrocardiography topics with your colleagues at Mayo Clinic.
This has been a Mayo Clinic podcast.